We have a self-contained neuroscience hospital here at Mercy Health Hauenstein Neurosciences. What's wonderful about that is that we pull patients from all over, both in a tertiary and quaternary fashion.
I've come to Hauenstein here after some 30 years of experience, both in academics, patient care, and research. Was recruited here to help build a new team. What we want to do here is achieve that center of excellence that's based upon Ralph Hauenstein's vision. He put this Hauenstein Neuroscience Center together for us. So we really have put together an excellent team here at Mercy Health. And the team is designed to provide very compassionate care and very excellent care, and to also provide not only the highest level of care for our community, but also research opportunities. We have angioplasty and stenting, which is a balloon procedure that opens up a blocked artery when there has been cerebral ischemia or a stroke.
Stroke care is one of our primary diagnoses that we focus on within the neurosciences here. People have acute events. They come into the emergency department as their entry point because of acute pathology that just occurred. It's a quick onset. And what we need to do then is immediately triage them, try to figure out what the problem is. And our ultimate goal is secondary prevention. We have to try to figure out what's causing that stroke because of very high incidence of those patients re-stroking if we don't take care of the problem.
It's not unusual for me in my clinic to see people in their 90s who've had a TIA or a stroke. So we have a real fertile field here for strokes based on disparities populations and based on the older population that we deal with. In the United States, there's close to 800,000 new strokes every year, of which about 23% are recurrent strokes. And the great state of Michigan adds quite a few strokes to those numbers of strokes.
We have a team of people, both a neurologist, neurosurgeon, neurointerventionalist, along with nurse navigators, therapists, pharmacists, all delivering care to that patient at one time. And it's very rare to find that in other centers.
It is comprehensive care in a community setting, which is quite unique. Most of the patients are taken care right away in the emergency department by our stroke team, and also when they come to the floor. And depending upon the patient, then we individualize the care while they're in the hospital.
The nurse navigator plays a really pivotal role here. The nurse navigator helps us provide the compassionate care that our culture dictates and that we believe in.
It's a very frightening thing when patients come to us for the conditions that they have. They're serious conditions. They have heightened anxiety, and that's what I work with a lot with the patient and the family. It involves seeing a patient from the time they come and then coming back in for their follow-up at whatever time frame that might be. It's a very rewarding role, and it's a privilege to be a part of these people's lives.
We've been fortunate here at Mercy Health Hauenstein Neuroscience Center to have been provided an environment where we could assemble a world-class team. My component consists of having patients coming to our suite, being assessed. After imaging and clinical assessment has determined that they would benefit from more invasive techniques. Our interventions, depending on whether it's a hemorrhagic or ischemic stroke, are comprised of different techniques that we use, different devices, such as clot extraction devices, stents, balloons, flow diverting systems, which are new means of diverting flow away from aneurysms, coil embolization of aneurysms, which may have been the cause of a hemorrhagic stroke, different techniques and devices we use to reestablish normal flow through vascularity to the brain.
Research is something that helps put a community hospital system that functions at a high level such as ours over the top. Our stroke neurologists or vascular neurologists are also trained not only in excellent clinical care and are board certified stroke neurologists, but they're also trained in research.
We are participating in a trial which is called DIAS-4 trial, which is desmoteplase in acute ischemic stroke. And desmoteplase actually is a novel thrombolytic, which is similar but different from alteplase. It has longer half-life and better safety profile as compared to tissue plasminogen activator. The other clinical trials we are participating are GRAD study, which is looking at the genetic risk and atrial fibrillation. As we have seen over the last few years that atrial fibrillation is a very important risk factor for stroke, and many young patients develop abnormal heart rhythm, what we call atrial fibrillation, and that increases the risk of stroke.
We're exceeding the standards nationally from all inpatient stroke outcomes. But our ultimate goal is to make sure that that patient doesn't stroke again. The reality is that patient has cardiovascular disease. That's not going to change. What you want to do is decrease the risk from it occurring again, whether it be a heart attack or a stroke.
One thing that's emphasized with Mercy Health Hauenstein Neuroscience Center is that we're part of our community. We owe things to our community for allowing us to have the privilege of taking care of our patients in our community here.
We take an extra step to take care of our patients and their families, and we get wonderful feedback from them. So this is very comforting for us as well, that we are providing such a great care in this community and in West Michigan.